My name is Tchalare Kondi Makagni. I'm a Fulbright scholar from Togo, and I'm currently pursuing my second year of Master of Public Health in our school, the High School of Public Health. My APE site name is the Department of Health and Mental Hygiene in the New York City. It's typically called APE Scholar. Like the short name is the APE Scholar. You type on Google is APE Scholar. Why did I choose this program? Because of the reputation of the department for its excellence in scientific research. My primary goal of my applied practical experience is to, as an MPH student in epidemiology, is to fulfill the requirement of my degree, and specifically to enhance my skill in data analysis, and also to have the real-world experience to apply epidemiologic methods to data analysis, to also collaborate with professionals in a real-world setting, and also to enhance my knowledge in terms of training the department provide, as I said previously, disease control, training regarding the program evaluation, training also regarding the One Health issues, environment safety, and they provide a lot of training that are huge curriculum for interns over there, and they are also wonderful people. They are supportive. The project on which I worked on my APE is to evaluate the mental health and needs of asylum seekers in New York City. Because New York City is a major city in which we currently have in 2025 200,000 asylum seekers arriving from all states and principally from the Mexico border. So this population face a lot of trauma and persecution coming from those states outside the US. So when they arrive in New York City, they are a lot of in need of mental support, emotional support, healthcare access, insurance, and let's say housing, like basic needs. So the city have to handle these populations. So that's why they developed this project, to kind of see inside the data how it will look like in the trend of the characteristic of this population. Let's say their demographic, where they are coming from, what are their needs, and what kind of trauma they faced before arriving in the New York City. So what I did basically is to bring my skills of data analysis. I'm not yet a complete data analysis, but the skills I gained in the Tulane are strong enough to help me work on a comprehensive data set, to recode variables, to develop a clean data set on which we can work on. And also I use a quantitative method in epidemiology that we learn to complete what I can say the study design, and also to end up developing evidence-based material that we can use to present to the staff, that will help them build some recommendations to the hierarchy and also for the city leaders in terms of promoting the health of these vulnerable population, and also to kind of help them prevent any kind of disease or any kind of let's say trauma that this population will face, because they already arrive with trauma. During my practicum, the moment that I realized that my work was doing a big difference is when I was presenting my findings, because I did two presentations in front of let's say the department. One in the AP ground round, which is a presentation in front of let's say the entire staff of the department when you're gonna present your findings, and they're gonna comment, they're gonna tell you what they feel about the study. And at this first presentation, I received a lot of great insight and congratulations because of the work we did in let's say few weeks, because I attended the department in June 25 and I completed all the steps till August, August 3, it's like August 3 of this year. So between this short period of time, what we produced as a result by the help of my preceptors was like huge. And many people over there, they realized that the findings that I produced can help them during the discussion in the staff, how they can tailor appropriate services for this vulnerable population in terms of access to healthcare, to promote their emotional support and their needs, to also know the way they can expand these findings to other agencies for collaborations. So for the second presentation that I did in front of now my bureau, which is the Bureau of Community Action Awareness, Response and Engagement, they also said that these findings or these work products will help them also with their acting commissioner design policy that they will share with the hierarchy and also with the leadership of the state. I really received a strong mentorship from these preceptors, and I don't know why, but in this bureau on which I worked, they were too much supportive. I can guarantee you, they are like officials that are interconnected in the bureau, the Bureau of Community Action, Awareness, Response, Engagement, that are more involved in that field activities. They are too much supportive. Indeed, I have a primary preceptor, but I also have many mentors. I also had many mentors in the department that are like, they want to help you as much as they can to reach your goal, and they are like open to every questions. And even if you don't ask questions, they will come to ask you questions. What do you need? And I didn't imagine this experience to be like that in this setting. And no one will get in there and get out without any transformation of his abilities and the way he can look the world differently, specifically in the field of public health, where we are right now in terms of promoting the health of population where you live. Yeah, so that's basically the experience I have with my mentors and preceptors over there. What advice can I give to students that want to study APE is like, for MPH students, the APE or the practicum is a requirement. So we need to look for APE and practicum. So one advice that I can provide is, among the flow, or let's say the available opportunities for internships, every student needs to look at the one that he or she found to be relevant or challenging for his intellectual and career progress. So I can say, taking it that way, you're gonna tailor every application based on what you want to be the skill you're gonna gain in the real world. And something also important is to know how to get the resources to support your application. Because, for example, for this program, it is a highly competitive program for top graduate epidemiology students and biostat students. But of course, there is always a way to get in there, because Tchalare is a great and excellent school that is well known in the US, that is well ranked. So Tchalare fits the, let's say, the requirement of getting access to this program as well. So my main takeaway for this APE is that it reinforced my passion for research and public health to address the health disparities of vulnerable populations.